They don't need to be put on these drugs. One of the side effects of these drugs is sudden death, but that's an acceptable side effect to our medical system. When it comes to drugs, they don't care about side effects. They just accept them.
That clip you just heard was Dr. Michael Platt. Dr. Michael Platt is a specialist in natural hormone replacement. He has given numerous seminars on hormones worldwide, including both in Europe and Asia. He's the author of the popular Miracle of Bioidentical Hormones and his latest book, Adrenaline Dominance, A Revolutionary Approach to Wellness. In this episode, we sat down with Dr. Michael Platt, also was joined by Dr. Beatty. I talked a lot about medical issues, but I want to stress the importance that these are opinions. This show is not intended to give medical advice. Anything you want to do in that respect, talk to your physician. This show is intended only to provide information for you to listen to, hopefully learn something from it, do your own research. I enjoyed the show, but again, this is not intended to give anyone any medical advice.
Welcome back to the Our 2 Cents podcast, the show where your local professionals sit down with an array of guests to hear their story and impart some wisdom for both business and life-improving skills. This is your place to hear business and community leaders discuss relevant topics that matter to you.
And welcome back to the Our 2 Cents podcast. I'm your host, Kyle Jones, and we have a unique episode today, so I want to kind of lay it out a little bit so our listeners can understand what's going on with these four voices you're going to be hearing throughout the day. So I'm joined in studio by my co-host, John Duffield, and Dr. Hugh Beatty, who is a local physician here in Bakersfield. He's been on the podcast a few times, and he's going to be helping us in our interview because it's going to be medically centered, I guess would be the way to put it. And our guest today is Dr. Michael Platt. He's joined us on Zoom. Dr. Platt, thank you for joining us.
Well, hi there.
Before we get going on the interview, I want to remind our listeners to follow us on Instagram. That's Our 2 Cents Podcast, plural. Visit our webpage. We have some new interactive stuff going on there that Shannon's doing with newsletters, upcoming guests, past guests, and feedback so that we can hopefully provide some good content to our local listeners here in Bakersfield. So Dr. Platt, I found your podcast with Dave Asprey, very interesting. And then when Shannon told me that she was reaching out with you to get us on the show, I was very intrigued because it is something that is quite interesting to me and it's something I want to continue to learn about. But before we get into the nuts and bolts of it, can you briefly explain what is adrenaline and why does our body produce it?
Well, just about everybody has heard of adrenaline. It's known as the fight or flight hormone. Adrenaline is both a hormone as well as a neurotransmitter. But what people don't realize is that excess adrenaline has a big effect on people's health. It's a very powerful hormone. And, most people think of it as being released in times of danger, but that's actually a very rare reason why the body puts out adrenaline. Most people don't realize that the primary function of adrenaline is to make sure that the brain has enough fuel. The brain actually uses more sugar than any other tissue in the body, and anytime the body detects that the brain is running out of fuel, sugar, it puts out adrenaline to raise glucose levels. Now, needless to say, the brain, adrenaline peaks around 2:30 in the morning because the brain runs out of fuel then. And a lot of people wake up at that time to urinate because adrenaline gives people that urge to urinate. Women, on television, they call it an overactive bladder. In other words, when they have to urinate, when they have to go, but that's adrenaline. And even bedwetting in children is caused by adrenaline. But we'll talk about all the consequences of having too much adrenaline later on.
So that explains why the body produces it. So is it a function of diet? So are you saying if you eat something, a carb, or maybe something like MCT oil before you go to bed, is that going to decrease your chances of your body then producing adrenaline to get your brain the energy it needs?
The primary approach to controlling adrenaline is nutritional. And people need to understand that the brain uses two different fuels. One is glucose and the other are ketones. And the best source of glucose for the brain actually comes from vegetables. You don't think of them as being high in sugar, but they are a carbohydrate. They do break down into glucose, but they don't produce a lot of insulin. Now, candy and soda are great sources of glucose, but they stimulate the release of a lot of insulin, which lowers sugar and it defeats the purpose. So vegetables are the best source of glucose for the brain, and the source of ketones comes from coconut oil and MCT oil. So by providing these two fuels, you can get a significant drop in adrenaline actually very quickly. And then the only other fuel that, the only other thing that somebody needs to control adrenaline is a 5% progesterone cream. And what that does, it blocks adrenaline. So did you want to start talking about adrenaline, or do you want to wait for a while? Or
No. I anytime. I just want to try to get as much of a fundamental background as possible for people who, who maybe have never heard of adrenaline, or I'm sure most people have, but maybe who never thought of hormones or diet, nutrition, or MCT oils. I just want to kind of give a more fundamental background, I guess.
Well, perhaps I should describe somebody who has a lot of adrenaline who may not realize it.
Perfect.
First of all, adrenaline is the number one reason why people have trouble sleeping, either falling asleep or staying asleep. And some people grind their teeth at night. Some people get up at night to urinate. This is all adrenaline. Restless leg syndrome is adrenaline. Tossing and turning is adrenaline. People with a lot of adrenaline will find that they're quick to anger because it's an anger hormone. And they may find that they have cold hands and cold feet because adrenaline cuts off blood supply to areas of the body not needed for survival. And that's where irritable bowel syndrome comes from. So they might be constipated. People with a lot of adrenaline will find that they have a lot of tension in the back of the neck. And this can actually cause ringing in the ears or headaches. And adrenaline is like the only source of anxiety. If people are feeling anxious, that's adrenaline. So these are the kind of things that people can experience when they had too much adrenaline.
Is there you're talking about too much adrenaline, but is there a right amount of adrenaline? Is there a good amount of adrenaline? Is it something that we need, or are we trying to eliminate it altogether?
Well, adrenaline as a neurotransmitter gives people intelligence. In fact, it would be safe to say that all intelligent people have a lot of adrenaline. And the other thing is it enhances what's called creativity. So these are the good things about adrenaline. ADHD, and here we're talking about millions and millions of children have ADHD. The most intelligent, successful, creative people in the world have ADHD. It's not a bad thing. And it's not a learning disorder. ADHD is strictly an interest disorder. In other words, if they're interested, they'll focus. If they're not interested, the adrenaline makes the mind go so quickly that they get distracted very easily. So the whole thing about ADHD is not a learning disorder. It's an interest disorder. They're interested, they'll focus. Again, when we talk about treatment, people will learn that if ADHD is an issue or a problem, you can actually eliminate it in 24 hours just by managing adrenaline. In fact, just about every condition caused by excess adrenaline can be eliminated. Conditions felt to be incurable, and we'll talk about those that are caused by excess adrenaline that can be eliminated.
So I heard you say there's some positives to adrenaline, obviously. So when you're talking about treatment of it, is it more of a management? Is it like, hey, I want excess adrenaline at times when I'm trying to be creative when I'm working, but when I'm at home relaxing or when I'm with my family, maybe I don't? Is that kind of the approach you're talking about?
It is management. You cannot eliminate adrenaline completely, but you can manage it, as you say.
Okay. Dr. Beatty, I'd like to hear some of your input on this, what we've heard so far, and maybe break it down some more layman's terms, but what we've spoken about.
Yeah, this concept of adrenaline dominance is a new one for me. As what Dr. Platt is saying, that this is not taught in medical school. I mean, we're taught about, the importance of, endocrine hormones. We know what fight and flight is and adrenaline. But when I first got exposed to one of his books called The Miracles of Hormones, I was so blown away about it. Then I looked up other books that he had, and so I saw adrenaline dominance. And then Shannon saw a post I put on Facebook about adrenaline dominance. And so I started learning more about it. And so I actually started using some of the concepts that Dr. Platt said. And I'm already seeing positive responses from the patients. But adrenaline dominance, he's correct about that. Adrenaline is a fight or flight hormone. And you can't sleep or rest when the adrenaline surge comes because you're ready to fight or flight. And so as I dwell more on his concepts and I've started applying to my patients, I'm seeing some tremendous benefits already. One of the things that I find is very important is hormone balance. And like he said, adrenaline is not only a hormone, but it's also a neurotransmitter. And so people who have estrogen dominance, I've been preaching that for about a good 8-9 years about the importance of estrogen dominance. But now I'm understanding the importance of adrenaline dominance and how estrogen and adrenaline dominance both can be treated by progesterone therapy. And so I've gotten a little bit more aggressive with progesterone therapy, and I'm feeling my way with it, but I'm seeing patients sleep better already. I'm seeing patients so far as losing weight. In addition to that, I had one guy, he was in my office today. He was there for some other therapy, and he's had problems with ADHD for years, since he was a little kid. And he's now in his mid-40s, and I put him on progesterone cream twice a day, and he said he already noticed that he doesn't have those symptoms anymore. He's focusing better, he's sleeping better. So it's early on for me, and so I'm here listening and learning from Dr. Platt like you guys are, but I'm able to apply those things, which is good. I'm already seeing some positive results.
John, looks like you had a question.
Kyle, you and I both listened to that Dave Asprey podcast, and I think it resonated to some degree with both of us. And we said, there's something here, and I want to understand more about it. Part that I'm curious and want to learn more about is the diet aspect of it and what that looks like in vegetables. And we've always been told to eat our vegetables, which most of us don't eat enough of. Mm-hmm. And so I'm curious as to what vegetables and timing and things of that nature too.
So I definitely want to get into the diet aspect of it too. But before we get there, I guess this question for both Dr. Platt and Dr. Beatty, is this something that increases with age, adrenaline dominance? Because I'm assuming that the younger you are, your hormones are more balanced and you don't need as much progesterone. Am I correct in that, or is that not accurate?
Well, actually, excess adrenaline can begin at childbirth. You may have heard of babies that have colic.
Yeah, I had a couple.
That's adrenaline. And that can be actually eliminated in 3 minutes just by putting progesterone cream on the baby's belly. And the babies that have colic are usually the ones that do a lot of kicking in the womb. And again, that excess kicking is adrenaline. And while we're talking about women that are pregnant, you may have heard of women that vomit throughout their entire pregnancy. They call it hyperemesis gravidarum. But again, that's also excess adrenaline. And then later on, bedwetting in children is only caused by excess adrenaline. And that you only find in creative type children. And the reason for that is that creative people have the most adrenaline. And then later on, ADHD comes. So excess adrenaline is with us from early on until death. It never goes away.
From an evolutionary standpoint, it almost seems like some of the excess adrenaline is a positive thing, right? If it increases creativity and it enhances intelligence. And for progression, it seems like we're maybe getting to where we're having more adrenaline dominance than maybe 100 years ago or 1,000 years ago. What are your thoughts on that?
Well, and also when you talk about athletes, they can attribute all their athletic excellence to adrenaline. Yeah, so there are some positive aspects to adrenaline, but like I say, it is a very powerful hormone and it has its downsides.
Yeah, but I think that what Kyle is probably thinking about is that how do we understand the concept of adrenaline dominance? I think of adrenaline that gets released with cortisol. And I know Kyle understands the cortisol concept a lot more because we can measure that with a 24-hour saliva cortisol test or 24-hour urine cortisol. And both of those impact, like you said, the insulin, the sugar cycle. And so when I started to grasp your concept of adrenaline dominance, I also thought about the aspect of the cortisol too. The problem is there's a mechanism to damper the effect of cortisol release with ACTH. But my question is, Dr. Platt, is there a way to dampen the effect of adrenaline release like you do have with ACTH and cortisol?
Adrenaline is what creates stress to the body. When you talk about stress, that's adrenaline. And the body releases cortisol to deal with stress. Now, and you can deal with excess adrenaline. Remember, by eating correct, just providing the brain with the right fuel and using progesterone cream. People can manage the amount of adrenaline that they want to deal with. But the thing about, cortisol is not a happy hormone. It can cause osteoporosis. It causes damage to the immune system. And it also is known for causing weight gain. But, what's interesting, remember I mentioned earlier that adrenaline peaks at 2:30 in the morning. And the reason why it peaks at that time is the brain runs out of fuel around that time and the body releases adrenaline to raise glucose, sugar levels. But as soon as the body releases adrenaline, it creates stress to the body. So then the body releases cortisol to deal with the stress from the adrenaline. And the first thing cortisol does, it also raises sugar levels. And this is all coming out while people are lying in bed. And the whole thing about sugar is that it doesn't matter whether you're eating sugar or if the body is making sugar. If you don't burn it up, the body takes all that extra sugar and puts it into the fat cells to be stored as fat. And I would say unequivocally that excess adrenaline is probably the number one cause of weight gain, and nobody ever talks about it.
No, I agree with that. But is there a negative feedback loop to adrenaline like there is for cortisol and ACTH and for other hormones from the pituitary?
Probably not. I wouldn't know. I wouldn't say there's a feedback loop.
Okay.
Not like other hormones.
I think you could try to ask what I was getting at. It seems like it's, when you're talking about adrenaline, it's almost abstract, right? Because maybe I don't know the answers, but can you measure adrenaline in a saliva test or a blood test?
I think indirectly you can by looking at the urine levels, because as soon as someone comes at you with the needle, what's going to happen to your adrenaline level? It's going to go up.
Right. I know, Dr. Platt, do you have any insight as to that? Whether it's calculable or measurable within the body?
You want to know what kind of vegetables or?
No, I'm sorry. The amount of adrenaline that you have in your body at a given time, is that measurable, calculable with a blood test, a urine test, a saliva test?
I've been doing hormones for a long time, and I've always felt more comfortable about treating people rather than lab tests. I look at lab tests, but unfortunately, they can be affected by a lot of different things and the time of day or the time of the month. But if somebody does want to find some kind of a test to correlate with their adrenaline, the best test there is a morning cortisol blood test, never a saliva test. And the reason why I say never a saliva test is that adrenaline cuts off blood supply to areas of the body not needed for survival, and that includes the salivary glands. This is how they come up with the diagnosis of adrenal fatigue, because it's a naturopath diagnosis, and they do saliva test. And when they do the saliva test for cortisol, it's low because the cortisol doesn't get into the saliva. If they did a blood test, they would find the cortisol level was elevated. So they diagnosed adrenal fatigue, which is a condition that doesn't exist. Adrenal fatigue is really adrenaline dominance. But the way they treat adrenal fatigue by trying to raise cortisol levels when the cortisol level is already elevated to begin with. So lab tests are not the end all. You can never go wrong treating a person, but you can go wrong treating a lab test.
I agree with that. 85% of the diagnosis comes from history and physical exam. And there's times when I see patients from a clinical perspective, they need help with hormones, even though sometimes the labs might not, actually correspond or reinforce that. So you're right about that.
Well, let's get to diet, because that's come up a few times, and I know John's got some questions going towards that. So, John, I'll let you take the lead on the diets.
Yeah, so I had, as I indicated earlier, I bought the book on adrenaline dominance and spent some time reading. And of course, I was curious to like everybody, is to get to the fix, right, and get to the answer, which at least in part seems to be diet. And so I'm curious as to what that diet should look like, and what do we eat, and when should we eat it?
Well, like I said before, the brain uses two different fuels. One is glucose and the other are ketones. And the best source of glucose for the brain comes from vegetables. Now, a really good side dish, if people like sweet potatoes, is to, instead of baking them, slice them up and fry them in coconut oil. And that way they get the combination of the ketones plus the glucose. And when people are eating vegetables during the day, I recommend that they save some to eat right before they go to sleep, and which is important, because remember, the brain is going to run out of fuel while they're sleeping, and the body will be putting out adrenaline. And also, when it comes to progesterone, I recommend that they use progesterone right before they eat. And the reason for that is that progesterone has a lot of benefits. And one of its benefits is that it helps to control insulin. As soon as people put food in their mouth, the body is putting out insulin. And when insulin levels go up, blood sugar drops. And when you get that drop in sugar, again, the body puts out adrenaline to raise the sugar level back up again. So one of the ways of controlling adrenaline is to control insulin. And what's nice about progesterone is that it blocks both insulin and adrenaline. Now, you can use progesterone anytime. It doesn't have to be right before eating, but it does help to control adrenaline. Now, when it comes to vegetables, white potatoes are not recommended because they're pretty high in sugar and they produce a lot of insulin. However, there's a thing called resistant starches. And a resistant starch is actually something that people can utilize. And when potatoes are cold, they become resistant starches. So you can actually have white potatoes as a potato salad, and you can have white rice with sushi, which is allowable because it becomes a resistant starch. It gets a little bit confusing, but I'm just saying that, people that, for example, that have road rage, and road rage is only caused by adrenaline. I mean, that's an example of adrenaline, road rage. But you can get rid of road rage in 24 hours just by eating correctly and using progesterone. I mean, that's how quickly, you can manage these problems. I didn't mention a condition called fibromyalgia that affects probably about, 6-8 million people. And everybody in this country that has fibromyalgia have been told there's no cure for it. And yet it's the easiest chronic pain condition to get rid of just by lowering adrenaline. They have another condition called PMDD, premenstrual dysphoric disorder. It's found that about 8% of women that are menstruating, and these are the women that 10 days out of the month, nobody can live with them because they have severe anger issues and mood swings. And again, considered incurable. But again, it's caused by adrenaline and it's easy to cure. So, unfortunately, doctors are not trained to treat the cause of illness. They're trained to give out Band-Aids. And they don't get anything really in the way of training about hormones, even though hormones control everything in the body. But, people have to realize the big pharma, the drug companies control our whole medical system, and they have no interest in people being healthy. I'm going to get off my soapbox, but I'm just saying that, people have to become proactive about their own health. They can't rely on a system that has no interest in their being healthy.
Well, yeah, the whole purpose of the system, to keep it going from a monetary standpoint, is to maintain sickness, right? So curing somebody, there's not really much profit in that. So I've been going down the rabbit hole, and I think I know your answer based on what you talked about with respect to John's question, but I've been researching a lot about a carnivore diet, and it seems like that's not something you would probably recommend.
You're talking about a carnivore diet is okay, but meat doesn't provide any fuel for the brain. But you can still have it. But and then there's a paleo diet. Now the problem with the paleo diet, it doesn't allow a lot of carbohydrates. But people can actually do a paleo diet and add green vegetables because green vegetables are zero glycemic. They don't produce any insulin. But as long as, and then you have people that do intermittent fasting, which means they go many, many hours without fuel coming in. So in a lot of respects, they're living on adrenaline. There are 100 different ways of approaching eating, but it's important to understand that all we're talking about is providing the brain with the right kind of fuel. It doesn't matter what you're eating, as long as you're providing the right fuel to the brain. If you have a problem with excess adrenaline, if there's no problem with excess adrenaline, then it doesn't matter how you're eating. And people should always keep in mind that adrenaline may be contributing to their increased weight. And also people that do a lot of exercise, muscles burn the glucose just like the brain does. So they may be depriving their brain just by doing a lot of exercise. So they'll be living on adrenaline. There's no one size fits all because everybody's different.
Well, that's kind of exactly where I was going to go with this. Is I've read countless testimonials about people who are doing the carnivore diet and they lost weight, they're sleeping better, they have more energy, stamina, all these positive things. And then I've seen countless testimonials from someone who's gone all vegan and they never felt better, their gut health is better, and all these different scenarios. They're completely opposite, right? They're pretty two extremes. And so, is it something more of that our bodies are pretty adaptable and can kind of do whatever, or is everyone that individualistic? And maybe Dr. Beatty here is set up, his gut biome, for example, is set up for a vegan type diet, and mine may be where I'm set for a carnivore diet. What's your thoughts on that?
I just want to say that Bakersfield should be proud to have somebody like Dr. Beatty. It's so nice to talk to wellness doctors, and he appreciates the fact that the body has an amazing capacity for healing itself as long as you allow it to.
That's true. In fact, if I can throw this aside, and today I have a friend, he's 56 years old, and we were doing some testosterone pellets in him, and he was just relating to my medical assistant. He said, I feel better in my 50s than I did in my 40s. I hit the ball farther in my 50s than I did in my 40s, and he looks actually better. And so he attributes it all to all the different things in wellness that and we went over his labs. He did not have one abnormal lab. In fact, his estrogen levels were under control. His cholesterol was only like 160. He's not on any medication. He's sleeping even better. He's a tall guy, so he has a history of chronic neck problems because he rode his vehicle years ago and injured his neck. And so I have to do epidurals every once in a while on him and also thoracic epidurals on him. But he's saying that his pain is under control now. I recently started having to do progesterone cream, like what you mentioned, when he's having some tightness in his neck because he was triggering headaches. And he said that's even better now. And so you're right. If you take a wellness approach to someone, they actually get better with time, and so he's excited, but he comes in just for maintenance, but he feels so much better.
Oh, good.
So is it something that's individualistic, where someone who's navigating these roads and trying to figure out the best way to make themselves healthy, right? Is it trial and error? I mean, do you recommend trying a vegan diet, trying a carnivore diet, trying progesterone, trying this, and then figuring out what works for you? Or is it something more general where you're saying your approach fits everyone?
No, it doesn't fit everyone, but it fits most people. But it's different for everybody because, some people do a lot of exercise, some people do no exercise. So different things have to be taken into account. But as long as they have the general idea that, their brain needs fuel, and if they provide the fuel and use the progesterone cream and to block the adrenaline, they're in control. And it doesn't take a long time to get better.
Well, the thing that I was so shocked by after reading the book on adrenaline dominance is how important progesterone is in treating both estrogen dominance and adrenaline dominance, and how progesterone is so beneficial but also safe. And just that message, if it gets out, is incredible. And I think what Kyle is getting at is that, how do we approach these things? What I'm finding is that in general, people in Bakersfield are stressed out. And I think in all of America, they're stressed out. And that stress is causing hormone imbalance tremendously, whether you're young or old. So we have to look at what's going on with their hormones. How is their diet affecting their hormones, their sleep, whether they're exercising or not, the health of their gut, the nutrition. And that's what I focus on. But the most important hormone I'm seeing consistently to treat these imbalances of hormones is progesterone over and over again.
While we're talking about progesterone, I should mention that people have to be a little bit careful because progesterone also comes in an oral form, like Prometrium, and they need to understand that when progesterone is taken orally, it goes through the GI tract, which means it'll go through the liver before anywhere else. And once it hits the liver converts it into a different hormone called allopregnanolone. So if people want the benefit of progesterone with regard to adrenaline, they need to stick with the cream, not the oral progesterone. Progesterone is not a woman's hormone. Men and women have the identical hormones, different levels, but exactly the same hormones. And men stop making progesterone right around the age of 50. It's gone. After that, men start putting on weight around the middle because they can't control insulin anymore. They start getting prostate cancer because they have no control over estrogen. And men's estrogen level is much higher than a women. Mm-hmm. Women have around that age. Again, it's because men and women have the same hormone. So it's an important hormone. It's like the Rodney Dangerfield of hormones. It has no respect.
That's so true.
Are there things that you can do to increase the natural production of progesterone in your body? I know with like testosterone, if certain like resistance training or weight strength type training, certain dieting you can do will actually increase your testosterone levels. Is that something that's true for progesterone that you guys know of?
I can't think of anything that people can do to increase their own progesterone.
No, like what he said, once you get to a certain age, just don't make. But the thing is, keep in mind, progesterone is affected by stress. The more stress you're under, the lower the progesterone going to be, because progesterone actually forms cortisol. And the other thing is keep in mind that poor sleep impacts your progesterone because you're stressed out. So look at it this way: the higher the stress, the lower the progesterone is going to tend to be.
So basically, what we're talking about is aging.
Yes.
I mean, I don't want to say it's the fountain of youth, but is using a hormone supplement like progesterone, is that a way of cheating aging?
I think so. I turned 63 the other day, and I feel great. And actually, you can use progesterone to help with fine wrinkles. Progesterone is good on your skin. I don't see any negative side effects of progesterone. And like what Dr. Platt pointed out in his book, progesterone is anti-estrogen. And estrogen is a harmful hormone in abundance. So,
well, anecdotally, Dr. Platt, how long have you been treating patients or customers with progesterone?
Probably about 30 years.
Okay, so going back to the people that you started, 30 years ago, anecdotally, what is that? What are they looking like 30 years later? Have you seen any side effects? Have you seen any ill effects of treating with progesterone that long?
The only time somebody will experience a negative effect from progesterone is if they have what's called insulin resistance in the brain. There's a condition called type 3 diabetes, which is insulin resistance in the brain. They don't have a test for it, but why it's important, it's probably the number one risk factor to developing Alzheimer's. And you may have heard of people that treat Alzheimer's with coconut oil. That's because coconut oil and MCT oil convert into ketones that go directly into the brain and they don't need insulin. So you can actually improve Alzheimer's a lot with MCT oil and coconut oil. But people that have type 3 diabetes, as soon as they use progesterone, will get a very rapid increase in actually levels of adrenaline. Because the thing about progesterone, one of its benefits is that it causes what's called insulin resistance to a small degree, and which means it prevents people from getting sleepy in the afternoon between 3 and 4 when insulin peaks, and prevents people getting sleepy after eating because insulin comes out after eating. And a lot of people get sleepy when they're driving, and progesterone prevents that also. But if somebody already has insulin resistance, progesterone can increase it. It makes it even harder for insulin to get glucose into the brain cells, and the body immediately puts out more adrenaline. So what's interesting is that, like I said, they don't have a test for insulin, type 3 diabetes, but progesterone cream actually is a test. So if somebody uses cream and gets an immediate outpouring of adrenaline, then you have to look at them as if they have type 3 diabetes. Now, there's another reason why something like this can happen is when people have no fuel in the brain. And they can also have an increase in adrenaline. But that can be fixed just by, again, giving people vegetables and coconut oil and MCT oil, and then retrying them with the progesterone cream. So, but aside from that, I don't know of really any downside to progesterone.
I try, John, if you don't mind sharing your experience, I'll share mine. So after I heard you on Dave Asprey's podcast, talked to, of course, my Dr. Beatty here, my friend and my physician, and said, here's what I'm thinking about doing. And he, of course, was on board, loved it. So I did, I think John bought me the bottle. I think he bought it from Dr. Platt's website, correct?
I did, yes.
Yep. 50 milligram was a pump, or 25?
I don't remember the...
Well, Dr. Platt, you would know. Is it 50 or 25, your progesterone? 50. Okay. So I tried that once. And I don't know if it was a placebo effect or I was just anxious about doing it because it was something new, but I felt like I had a very anxious reaction to it. I took it right before going to bed. I was trying to help, use it for sleep purposes. And I felt I had an opposite effect. So talked to Dr. Beatty about it and didn't use it again. And then wrote me a prescription that local pharmacy filled. And it's a 10 milligram little dot of lotion that I put on the back of my neck or on my forehead before I go to bed. And I've had great results with that. And so anecdotally, from my perspective, 50 was too much. I don't know if it was a one-off or if I was just made myself anxious because I was trying something new. But anyway, I found out 10 to be beneficial for me for sleep purposes. John, I don't know what you want to experience, your experience with what you tried.
Yeah, Kyle, kind of the same thing for me. Less is more to some degree. I've found that I don't need a lot of it. And so what I've had to do is kind of measure, if you get that 50 milligram pump, then I'm dosing down, if you will. And it definitely has an effect on me. There's no doubt.
Dr. Beatty, how about you personal use? What are you trying and using and what's your...
Well, right now with the patients, I'm kind of, it's kind of new for me because I used to just give them the progesterone at night to help them for sleep. And so now I'm using more of the cream, and the dose I'm prescribing people is 25 milligrams topically.
Okay.
And I'm having, most of the women I'm using is in postmenopausal women. So they're not, menstruating any longer. Some of the women are doing better on the oral progesterone at night because they really want that for sleep. And I heard what Dr. Platt said about it converts in the liver, the first pass effect. And then I'm having to do progesterone cream in the morning because they tend to wake up feeling anxious and stressed out, can't focus. And now they're telling me already that that's a good combination for them. And so some of them I'm saying, okay, why don't you just use the topical cream morning and night? And I'm finding that if you keep the adrenaline levels under control during the day, they're going to sleep better. They don't need it converted to what Dr. Platt was saying that happens in the liver. So I agree with that. So early on for me, the most important thing for me is that I know everybody's an individual and you have to take one patient at a time, see how they respond to things and use your clinical judgment. And I know that progesterone, for the most part, is very safe to use. And I'm actually testing people. I have them come in for routine follow-ups, and the patients are doing better as I go along. I try not to make too many adjustments. Like sometimes you look at the patient and say, well, we need to adjust this, this, and this. If I'm adjusting their progesterone, I'm just leaving that as the only thing I adjust. I don't adjust with other things right now, just to see the response.
Okay. Dr. Platt, you've heard all three of us share our experiences. And so in your 30 years, is there a right dose? Is it individual specific or what have you found that works? And how often, once, twice a day, 3 times a day, before every meal, at night? What have you found over the years?
Well, the reason for the 5% strength, and 5% means each pump is 50 milligrams, is that's the exact strength that has been noted to block adrenaline. But, it all comes down to whatever works. Now, people have to be a little bit careful about using a low dose of progesterone because that can actually go to estrogen receptor sites. So, like I say, if somebody can get away with half a pump, which is 25 milligrams, that's fine. I haven't noticed that a lot, but you guys seem to do really well, and that's good.
So speak a little bit, if you know more, about using too little. That's something I've never actually heard about. With the estrogen receptor sites, you said if you too low of a dose, what does that entail?
Well, when it affects estrogen receptor sites, you have to be careful because estrogen is not a happy hormone. it can enlarge the prostate and cause prostate cancer and all this kind of stuff in men. And for women, it can exacerbate fibroids or endometriosis, which is caused by estrogen.
I guess more specifically, what I'm asking is, why does a low dose of it increase that risk versus a higher dose doesn't? What's the mechanism of that?
It's a good question, but the higher dose actually blocks estrogen instead of going to receptor sites. It blocks estrogen receptor sites.
Is it because of a competitive blockade? At the receptor site, you can have a competitive blockade if you have higher doses. Is that what you're getting at?
I'm not a scientist or a researcher, but it could be that it either blocks the receptor sites which is probably the way it works. Mm-hmm. But a low dose can maybe activate the receptor sites.
In your mind, what constitutes a low dose?
Well, for example, most over-the-counter progesterones are like 2% or less. So that to me is a low dose. John Lee is the one that said that women only produce 20 milligrams of progesterone, which is where that 2% came from. He was wrong about that, but that it sort of became encompassed in the progesterone industry. So most are 2% strength.
Well, I was taught when I go to my courses that progesterone, women make anywhere from 50 to 200 milligrams of progesterone a day.
You're talking about a cream?
No, I'm saying that a woman, a healthy menstruating woman, can produce anywhere from 50 to 200 milligrams per day. That's what they taught me.
And when a woman is pregnant, her level
much higher.
Blood goes up to like 400 something.
Yeah.
Progesterone cream that you guys use, meaning Dr. Beatty and Dr. Platt, is it bioidentical?
It is bioidentical.
Yes.
All that means it's the exact molecule that the body produces. It is natural. It's bioidentical.
And is there progesterone cream out there that's not bioidentical?
Yes.
Most are bioidentical.
Yeah, what he's getting at, there's synthetic progesterone. What they call it's progesterone, but it's a misnomer. It's not even the same molecule, like Provera, medroxyprogesterone. That's what he's talking about.
The progesterone made by drug companies is synthetic.
Yeah, that's what I'm asking. So there are synthetic.
And those actually stimulate the estrogen receptors for sure, and they can increase your risk of cancer.
Yeah, which have the same side effects as estrogen.
Yes.
So that's an important note. Obviously, if someone's interested in looking into this or experimenting with this, to make sure that what they're taking is bioidentical. Would that be a fair statement?
Yeah, I have a patient, actually a potential patient. I'm seeing her son. Her son has Klinefelter. So I've been prescribing testosterone cream for him. He's doing very well. But his mom was saying to me, hey, I've been bleeding for about 7 days. What do you think is going on? I'm on hormone therapy. She was getting testosterone pellets, and she said she was on progesterone but no estrogen. And I questioned the progesterone she was getting, and she said it was prescribed by her physician, and she actually went to a regular pharmacy to get it, not a compound pharmacy, and it was also covered by insurance. And that's not typical of bioidentical compounded hormones. And also progesterone is not known to cause this breakthrough bleeding like that, but synthetic progesterone can. And so I questioned, I said, you need to ask your physician actually what type of progesterone this is. Now it was 200 milligrams. I don't think prometrium comes in more than 100 milligrams. She was not really aware of what type of progesterone it was. And I think that happens a lot of time when you go to your physician, they confuse the progesterone. There's progestins and there's progestinogens, but then there's progesterone. Just like there's estrogen, but estrogen, there's 3 different types of estrogen the body makes: estrone, estradiol, and estriol. But the body only makes one progesterone, bioidentical progesterone. But there's synthetic progestrogens out there, and they confuse it, especially when you look on Google. They lump it all in the same bag. The problem with synthetic progesterone, it does the total opposite. It causes cardiovascular problems. It raises your blood pressure. It can cause strokes, heart attacks, embolic disease. But natural bioidentical progesterone does the total opposite. And so sometimes I tell patients, look, read about progesterone. They go on Google and they get confused. And so I constantly have to remind them there's a big difference.
So I guess you can't patent bioidentical progesterone, right?
No, that's why they don't.
Okay.
That's why they don't sell it as a prescribed. They sell the synthetic. So you have to go to compound pharmacy to get the bioidentical.
Okay. Getting to your books, Dr. Platt, The Miracle of Bioidentical Hormones and Adrenaline Dominance, a Revolutionary Approach to Wellness. What inspired you to write these books, and what led you to promote them?
Well, going back the reason I got involved with hormones to begin with, my mother died at a young age. She was 61 of breast cancer. And right after she died, I realized that I had inherited her hormones. Remember, men and women had the same hormones. And she had a belly on her. And the only thing that puts on fat around the middle is increased insulin. At that time, I used to have to slap my face when I was driving, trying to keep my eyes open. So I knew I was getting low blood sugars. And at the same time, because she had breast cancer, I realized she was low in progesterone. So I started to think, well, maybe there's a relationship between the insulin and the estrogen. So I started using progesterone. And as soon as I started using it, I never got sleepy again. So I knew that, progesterone affects insulin. And that's how I got interested in hormones. And I learned as much as I could. And eventually I opened up a clinic devoted to hormones. But I had an advantage that I was able to spend about 2 hours with every patient. And when you sit down and talk to a patient, that's how you learn how the body operates. And I started noticing a connection between a lot of the symptoms they were having, which could only be caused by a hormone called adrenaline. But what I noted that when I started using progesterone, that these symptoms disappeared. So that's when I started looking at adrenaline. But the first book, The Miracle of Bioidentical Hormones, that was before I got involved with adrenaline. But the reason I wrote it was to show the medical community that by treating people with hormones, you can actually eliminate a lot of conditions and get them off medications, get them off drugs. Needless to say, I got in a lot of trouble because of that book, because the medical board funded by drug companies didn't like the book. They felt that the ideas were so dangerous, I shouldn't be practicing medicine. And then the second book was all related to adrenaline and the relationship between adrenaline and a lot of different conditions. But medicine has always been a passion for me. And getting people well, it's very rewarding. I talk about this 47-year-old man that came in to see me. The reason he came in is because every morning he would wake up and vomit. And the only thing that causes that kind of vomiting is adrenaline. There's nothing else that'll cause that. And he also had severe fibromyalgia, which is understandable because he had a lot of adrenaline. So I put some progesterone cream on his forearm and had him rub the two arms together. And we started talking again. And about 5 minutes after I put the cream on, he looked at me and he said, "Doc, in my entire life, I've never felt this good." And that's after 5 minutes. The point is that it's very rewarding to get people to feel better. It is. But you can only do that by treating the reason why they don't feel well. That's where hormones come in, because they control everything. I've also written a manual for doctors to explain how I use hormones to get people well. So that's how that's basically how I got involved with hormones.
You can see how this is a contrary viewpoint to, I don't want to say a mainstream narrative, but to a Western approach to medicine. What do you say to people out there who are skeptical that this is something that's contrary to kind of what they've always thought or what they've always been told?
Well, they have a thing called evidence-based medicine. And evidence-based medicine is basically where they do studies and they have control groups and whatever. But it's done by drug companies because they're the only ones that can afford to do evidence-based medicine studies. But they can control it. They can control the outcome. Before that, they had something called observational-based medicine, where doctors would observe patients after trying something. And that's what I have done, is observational-based medicine. But, they give that a bad mark because they consider that anecdotal because it's not evidence-based medicine. But to me, real type of studies are observational-based medicine where you get actual findings. But if you ever read my books, you'll notice that there are no references in my books to other articles or other books, because everything I have learned just from talking to patients and seeing how they react to things. So it's all observational. But I think that ever since we got involved with evidence-based medicine, we stopped getting people better. With no great discoveries in medicine.
Dr. Beatty, you're nodding your head like a bobblehead over here.
Yes, because
I'm assuming you agree.
I've seen that in practice since 2013. And that's why I started going to those courses at American Academy of Anti-Aging Medicine. It reminds me of back in 2012, before I went to my first course, there's a Dr. Forrest Tennant. I don't know if Dr. Platt heard of him. But he said to me once when I was about to be a speaker for Millennial Health, he said to me, he said, Hugh, hormones are the future. He said, if you want to get somebody well and healthy, learn about hormones. And I didn't know where to go to learn about hormones, but then I finally found the Academy of Anti-Aging Medicine, A4M. American Academy of Anti-Aging Medicine. And he was totally right. And medical care manages your illness. It keeps you sick. The patients have to come back. They never get well. And I tell patients that all the time. I said, do you want to be well? Then we have to take a different approach. And I agree with Dr. Platt. I'm practicing real medicine now. I'm trying to deal with the underlying cause and treat that. And if you ask the typical patient, none of them want to be managed. None of them want to stay sick. They say, Doc, you know what? I really like you and all, but I would rather not come in here on a regular basis. I don't want to be on medications. I want to lose weight. I want to sleep better. I want to be active. I want to look as good as I did 20 years ago. And you can't do that with, I guess, traditional medicine, if you want to call it that. You can do that with real medicine when you look and say, hey, you know what, your hormones are off, let's start there. And then you give the body back what it's deficient in. When you give the body back what it needs, it performs. Just like a car. Car's out of gas, it's not going to perform. You put anything else in there but gas. The car was designed for gasoline if it's a gasoline-powered car. Just like our bodies needs the hormones. That's what God gave us initially. And if we want to be well, we got to get back to what we had at the time. You need water. You need salt, you need hormones, you need those things that make the body work efficiently. So that's how I look at it. So for me, it was a no-brainer. And I will say this one quick point. When I went to my first course on wellness care or anti-aging medicine, I was blown away in the first lecture because I really said, wow, this is going to teach me how to treat the underlying cause of disease instead of masking disease.
Would you say that progesterone is the most important hormone?
I like to think of it as being certainly one of the most important hormones. It's certainly way up there.
I learned this through Dr. Beatty, not ashamed to admit it, but before I started seeing him, I didn't realize that cholesterol was a hormone, right? Because I've always suffered a little bit with high cholesterol, and I just assumed, maybe that means I have a bad diet, maybe it means I'm going to have a heart attack someday soon, I don't know, but I didn't realize cholesterol was a hormone. So with that being said, progesterone, cholesterol, any relation with the two? Can one help the other, one benefit the other?
Well, hormones are made out of cholesterol.
Mm-hmm. So that means I have good hormones if I have high cholesterol?
And I should also tell you that people with the highest cholesterols have the greatest longevity. And another thing that might be missing is that when I was doing my training, they used to call cholesterol the poor man's thyroid test. And the reason for that is that the thyroid controls cholesterol metabolism. But very often it's rare that doctors even look at the thyroid when they're looking at cholesterol. But, do they have you on a statin drug?
No, Dr. Beatty won't let me do that.
Okay, well, they cause brain damage and memory loss and aches and pains and permanent nerve damage, irreversible kidney failure. They cause diabetes, and they're toxic drugs. But, 75% of people that have heart attacks have with a low cholesterol, not a high cholesterol. So cholesterol is not the reason why people have problems. And yet these are like the largest selling drugs in the world. But when they came out with Lipitor, they couldn't get enough people on the drugs. So the drug companies lowered the upper limits of normal, went down to 260. And overnight, millions of people had to get on the drugs. Then they went down to 240, 220, 200. They actually got the normal level down to 160 because they wanted to put children on these drugs. Now it's back up to 200 as a normal cholesterol, but cholesterol is not the enemy.
I tell people all the time that cholesterol is a natural antioxidant. It's a natural anti-inflammatory. And so your cholesterol is rising for a reason. And one of the things that people aren't aware of is that chronic stress can lead to high cholesterol because cholesterol actually makes through the mechanism cortisol. So you got to keep that in mind too.
Well, I mean, you can see how contrary this is. Someone listening to this is thinking that we're all probably whacked out of our mind here because how many times have you been told that high cholesterol is bad? I mean, you can ask probably a 10-year-old and they're going to recite that language. So,
yeah, but keep in mind, why is it high? That's what we need to look at.
But so if it's high and that leads to longevity, you want it high. I mean, you can see how contrary this is.
Well, as long as you don't have other inflammatory illnesses going on. I've seen patients over the years that were in their 80s that had high cholesterol, refused to take statin drugs, and they made it into their 80s with high cholesterol. So I understand what Dr. Platt is saying, but what I do, I don't treat the number. I look at it and say, okay, cholesterol's high. What else is going on? If they got insulin resistance going on, if their blood pressure is high, they're obese, I start dealing with those issues there. I don't just say, oh, your cholesterol's high, here's a statin drug, or your cholesterol is not high, you're fine. I've seen patients who are diabetic with normal cholesterol numbers. So you just have to look at the whole patient.
Yes.
Everybody's an individual. So,
all right, we got to do some rapid fire questions. We'll each take a turn asking you just random questions. Could be based on what we've talked about today, or it could be something completely unrelated. And so shoot around the horn, Dr. Beatty.
Mm-hmm.
One question you want to ask Dr. Platt before we go today?
Well, I know he's been doing wellness for a long time, and I know he's gotten great results. But why did he persist at doing wellness even though he was under attack? Because he was under attack from the medical board and things like that. And I would like to know why he, felt it was so important to persist at what he was doing.
Back around 2010, I was literally forced to surrender my license. And the reason for that is that the doctors of my town had complained to the medical board that I was taking their patients off their medications, which is true. But when you treat the underlying cause of illness, they don't need drugs. But the medical boards, again, are funded by drug companies. So they got interested in me. They couldn't investigate me because they never had a patient complaint. So they sent in undercover patients to initiate complaints. That's how and all they could come up with is the fact that for example, there are some women that have what's called stress incontinence, where they cough or sneeze and urine leaks out. And that's because they lose the muscle control around the urethra. And that's real easy to treat just by using some testosterone cream intravaginally. And they do those Kegel exercises. In 3 to 6 days, it's gone. But the fact that I was treating them without doing a pelvic exam, they wanted to take away my license for not doing a pelvic exam. They were just looking for things. So I spent $500,000 trying to fight them. You can't beat them. So finally, I just surrendered my license. But the thing is that I never changed. But then again, I've been arrested 4 times by the medical board. I just have a feeling that people need to hear that there are different ways of approaching wellness. Dr. Beatty, wonderfully, it's great to have people like him. I provide progesterone cream to doctors all over the country, wholesale. So it's getting out there, the approach to treating patients. And so I'm still involved, but I still have my MD, but I'm not licensed.
Yeah, I think I want to kind of throw some answer out there for this issue. What I do is that what they told us in A4M and other wellness courses I've gone to, they said, practice medicine. And what that means, see the patient, take a history, examine the patient, use appropriate referrals. And what I do, I have a good relationship with a lot of specialists in town. The specialists I use for certain things. When the patient comes in, they have heart disease, I let the cardiologist work them up. I let them do the tests they think they need to do, or whatever procedures they want to do. And then when the patient comes back to me, I say, okay, now you have the information, we have the diagnosis, we have it confirmed by a specialist. Here's the medical approach and here's the wellness approach. And what I do, I come along and do an integrated approach at that point. I don't stop any of the medications. I start going ahead and say, look, your hormones are off. Let's go ahead and deal with this insulin resistance. Let's do all these other things. Now the patient starts getting healthy. I get them, encouraging them to go to the gym. I start dealing with their pain management because I do have a pain management background. And when those patients get healthy, they start telling me, Doc, I don't need these meds. Why am I going to the specialist? I feel great. I let them make the decision. I can't force a patient to go to the specialist, and I can't force the patient to take the medications. And once they're well, no one can challenge that. So the thing is, I think what the medical board is looking at is the medical board is, what is your approach to getting these people healthy? I don't stop anyone's meds when they come and say, Doc, I don't want to take these meds. I want to stop. I heard that you do wellness. I want to start. I say, no, we're not going to stop any meds. Let's start the process. Because a lot of times patients are not committed as much as they think they are to a wellness program. They want to get off the meds. And then I said, now you're in limbo. You're not doing anything that leads to wellness, and you're not doing a medical approach. And I said, I don't agree with that approach at all. That's what gets you in trouble with the medical board. That's my opinion.
Dr. Platt, do you want to comment on that?
I could have used him.
Well, no, that makes sense, right? Because if you take someone off their medication and then that's all you do, well, that's probably going to cause some harm, right?
Yeah.
Some damages. So yeah, that makes sense to have an integrated approach. John, take the next stab at the next rapid fire question.
Yeah, doctor, I have a question about stimulants basically and adrenaline dominance. So things like caffeine, all the kids today are drinking energy drinks. And so what's that relationship with adrenaline dominance and all the stimulants that we see going around today, including a simple cup of coffee, caffeine?
Usually caffeine is not a problem, even though it is a stimulant. What's interesting, you have all these kids with ADHD and they put them on drugs like Ritalin, Strattera, Adderall, And what's interesting is that if they didn't have ADHD, these drugs would give it to them because these drugs are pure adrenaline. And what they do, they numb the mind, which is why a lot of these kids don't like these drugs. But again, let me repeat, you can actually get rid of ADHD in just about 24 hours just by managing adrenaline. They don't need to be put on these drugs. One of the side effects of these drugs is sudden death, but that's an acceptable side effect to our medical system. When it comes to drugs, they don't care about side effects. They just accept them. So stimulants usually are not that big a problem. And if they are, as soon as you lower the adrenaline, then there'll be no problem with the energy drinks and the caffeine.
Thank you.
All right, my turn. I know we talked about a lot today, but I know it's more of a holistic approach, but just kind of dumb it down a little bit. What would be more important in your perspective with respect to treating adrenaline dominance? If you only could choose one, the progesterone cream or a proper diet?
Actually, of the two, the eating correctly is more important than the progesterone cream. What's nice about progesterone, it blocks adrenaline. But the major benefit when it comes to managing adrenaline is to lower it. And the only way you can lower it is by providing the brain with the fuel so the body doesn't have to use adrenaline to provide it.
So it's almost like the progesterone is kind of like a Band-Aid approach, almost, in a way, draw an analogy to fixing the issue when maybe proper health and diet would be the more holistic approach.
Hey, Kyle, I like to say this. What is easier to have a patient do? Eat healthy or apply progesterone? It's hard to get people to eat healthy. They don't want to do it, so.
That's probably goes back to the same thing with the whole Western medicine approach. Yeah. Is it better to get people to lower their blood pressure and get off their diabetes drugs, or is it easier for them to just pop a pill?
It's the difference between what's right and what's easy,
right? Because you could apply that approach to anything, right?
Yeah, you can.
All right, Dr. Platt, we've took enough of your time. Thank you so much for joining us. I'm sorry we've had some audio issues. I think there's most of the questions hopefully were asked and answered well, but again, we appreciate your time.
It's been a pleasure. So
have a good one.
Okay.
All right. Take care.
This show has been brought to you by the Law Office of Kyle Jones, Troy Burton with the Lynn Company, CPA John Duffield, Scott Hansen Real Estate Lender, Broker and Investor, and Shannon Eckroth with the Eckroth Sales and Marketing Agency, LLC. You've been listening to the Our 2 Cents podcast. Check out the show notes for links and more information about the show. Also visit our website at our2centspodcast.com or catch us on Instagram at Our 2 Cents Podcast. If you enjoyed this podcast, please subscribe